and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Brad, today we're going to talk about just how to choose a knee brace for arthritis or knee pain. This is just a general brace, a good, affordable brace. You can spend, hundreds of dollars on braces, especially for arthritis.
Closer to 1,000 in some cases.
Yep, and those are custom made, and they're unloading or offloading braces.
Right.
But they are very expensive, and they're also very bulky.
Sure.
So this is just a good size brace that'll give you, it'll reduce some of the stress on the knee. It'll help with some stability, and it'll help with some pain. It's just
as well as hyperextension.
Oh, right.
Because they do have
braces.
Yep. Metal hinges.
Metal hinges. Yeah.
So they help lateral as well as hyperextension.
Yeah, we'll have to show that on the skeleton at some point.
Absolutely.
Well, why don't we do that right now?
Well, of course, Bob.
Well, we talked about instability. As you get arthritis in your knee, it kind of throws the joint off. Are you down here, Lonnie? You can get lateral movement like this, shaking back and forth, this way too, forward and back. So if that brace, if that hinge is on there, it kind of helps stop that. It helps hold it in place.
And if you're, you couldn't, the slang word bow-legged or knock-kneed, that'll kind of help support that in the proper direction as well. And if you hyperextend, let's turn them sideways. Some people do, and particularly people who have a stroke, sometimes will hyperextend. So with this brace on, it bends, but it does not go the opposite direction, so it'll help minimize that kind of irritation.
Yeah, and these braces all come with these hinges in them. You can take them out, especially if you need to wash the brace. Which, by the way, you're supposed to hand wash them.
Sure.
Don't throw them in the washer or dryer, and you make sure the Velcro is all locked up. Otherwise, that's a problem. So, all right, we talked with the good people at Braceabilitycom, and I'll put that down below and down in the comments or down in the information down below. And they sent us some braces. They were really kind enough to do so.
Yeah.
We liked their braces. That's why we contacted them. They got some really good braces. The other thing that they have, which I really like, is they really have a large range of sizes.
Sure.
They go from small all the way to 6XL.
Okay.
So, and that's the problem. A lot of times for people who are a little bit larger, they can't find a brace that fits.
Right. You get that bariatric population, and that's what we're looking for, something that'll accommodate their legs.
And so what happens is they can't exercise because the knee hurts, and so they gain even more weight. So this is, I think, a great solution for that. So I think the keys to a good brace is having the right fit and comfort.
And can you get it on and off easily?
Right. Good point.
So this is a wraparound brace, as opposed to the sleeve where you pull up and over.
Right. The sleeve is fine in some instances. I'm not going to go against that, but that's not what we're advocating right here.
So here you look at the name, so you put the letters up so you can read it.
That's up on top. Yep.
And
goes up.
The hole in the back goes behind the knee.
Which is, by the way, a nice feature, because otherwise it gets bunched up behind the knee, and if you ever wear a brace, you can tell, you know that you don't want to have anything bunching up.
It's irritable and it gets a little hotter,
So you usually wrap the top one first, Brad, or the bottom one? It doesn't really matter, does it?
I like to do the bottom one first, but it's kind of an individual thing. If the taper goes up, I find that at the bottom, anything that goes against Bob, I'll do.
So you put up those first two closures.
Look at that, right? The kneecap.
And that's where you want the patella or the kneecap, right in the hole there. And again, that's for comfort. If you got one of those braces that you're pulling up over the top of it, it's going to push right on the kneecap. Again, those are fine for other certain instances, but in arthritis, I think this is probably more appropriate.
Sure.
So then you have the other two straps here that you can actually cinch.
This is what I like about it. I just used this exact same brace yesterday on a stroke patient who has hyperextension, instability in the knee, and
I bet you it stopped the hyperextension, didn't it?
He did very well with it. And he walked farther with it. He felt more confident with it, and I'm not just saying that.
I bet you aren't just saying that.
No, of course not.
So now you can wear this over the pants too, wouldn't you say, Brad?
Oh yeah. Yep.
Yeah, a lot of people do. Or you can slide the pants over it. or you can wear sporty shorts like I do.
Yeah, you look
So,
hot in those.
don't I?
We are going to have the women just commenting on you, Bob.
Some of the elderly 80-year-old women.
Of course.
Now, the material on this is a breathable neoprene alternative. I don't know what that means, but it's not neoprene. Neoprene it does tend to be a little bit uncomfortable.
Yeah.
And this is supposed to be moisture wicking.
Sure.
So it helps with that. One thing I want to make a point, Brad, you don't need copper and you don't need magnets. There's no, I mean, you laugh, but a lot of people think there's something magical to those.
Right.
And there really isn't. The studies haven't held up on those at all.
Right.
And again, this has the hinges in here. They do remove.
Yeah, if you don't like the hinges, you don't need that support, take them out and you can use it without.
That's exactly right. If you don't feel like if the knee's not unstable, I would go ahead and take them out, and you just got to, on the inside, you'll find a slot where the hinges and you just pull them right out.
Yeah.
So, we should talk about how to measure for this, Brad.
Okay.
Okay, so very simple. They want two measurements. One, they want right around the kneecap itself,
Okay.
with a tape measure.
Yep.
And then you go 6 inches from the top of the kneecap up, and then take another measure right here on the thigh.
Here, let me draw on your leg, Bob.
I bet you
There
just-
you go. See,
Yeah, there
see
you
how
go.
that works?
Yep. So those two spots, you send them in, or you go online, and they'll tell you what size then you need.
Sure.
And again, small all the way to 6XL, so they're going to have your size for you.
Oh, yeah.
Very critical to get the right fit on this. This brace, I think they call it the obesity brace,
Okay.
which I'm not thrilled about the name. I mean,
Right.
But anyway, the price is $59.99. So that's a good price. And I think that's the same price no matter what size you get.
Oh, really? Okay.
So,
Sure.
good price. Give them a visit if you're having some knee pain. This will help you take that pain level down so you can exercise again and
Give you that support that
get
you need.
strong like Bull.
Wow,
I
Bob, of
took his
course.
line.
Why,
You want to
Bob?
say it, Brad?
No, you didn't roll the R. Strong leg bull. You
Okay, there we go. Here's our Bull.
There you go.
Thanks for watching.